Breakfast Show here on S3. It's time for our health talk on this Tuesday. And today we're focusing on irritable bowel syndrome. IBS is a fairly common disease that strikes anywhere between 10 to about 15% of the general population. So there's no need to feel like you're suffering alone. And the month of April is recognized as IBS Awareness Month. And this morning we are joined by registered dietitian Clara McClunan to share more about this condition. Clara, so good to connect with you this morning.
Thank you so much for having me.
So good. Let's start right at the beginning, because a lot of people can feel like, I have a little bit of symptoms of IBS, but what exactly is IBS?
So IBS, as you've mentioned, is irritable bowel syndrome. And I just want to say that it is one of the most common GI disorders worldwide. So IBS, to define it, it is a group of symptoms that a person can experience to have an effect on the digestive system. So these group of symptoms can be moderate to mild to severe abdominal pain, discomfort, so your cramps, diarrhea, constipation, so irregularities and abnormal bowel movements and function.
I don't know if this is a silly question, but are there different types or different stages of IBS?
Yes, so we have three main types of IBS, and they are categorized according to the types of bowel movements that you experience with it. So we have IBS-D, which is associated with IBS diarrhea, and this is your very loose and watery stools. IBS-C, which is with constipation, so this is your very hard and strained stools. And then you have IBS-M, which is a mixture of the two. But it's important to note that the patients with IBS-M, they have the diarrhea and constipation on the same day.
And I'm sure food plays such a big role when it comes to IBS, our gut, and all of these things. But what actually causes IBS? Do we know that?
So unfortunately, researchers can't say 100% what causes IBS. And that's always so frustrating because everybody wants to know exactly how can I prevent it or why is this happening to me. They have, however, pinpointed it down to a couple of factors. The first factor that I can mention is dysmotility. So what this means is that your GI tract is contracting, and it does all the time for us to pass food through our systems through peristalsis, but it either contracts for too long or for too hard, and that's what causes the severe pain and discomfort. You can also have very sensitive nerve endings inside your GI tract. Again, if they are just oversensitized, they can also result in it being very sore and painful. And then you also have like a miscommunication between your brain and your gut. So I'm not sure if you're familiar with the gut-brain axis. There's a lot of new research that's out on that, but your gut and your brain talk to one another, and they play a very important role with one another. So it's when your brain is telling your gut to contract, but your gut is then actually contracting too hard or for too long a period.
Okay, I've actually recently started, working about gut health and really understanding what gut health is, and that's where food came into play with my journey with, IBS, thinking that I have it because, the cramping you were speaking about, the diarrhea, these are some of the symptoms. What other symptoms would indicate that we have IBS?
Yes, so you mentioned that about 10 to 15% of our population experiences IBS. In South Africa, it's actually 8%. And a lot of our people are living with IBS and they don't know it. So they're going undiagnosed, and it really does affect a person's quality of life. Because as you mentioned, they experience severe abdominal pain, discomfort, so your tummy is cramping all the time, which is not nice. Then you've got bouts of diarrhea, constipation. You don't know, if you need to run to the loo or not. Excessive bloating and gas, so especially for females, it's so uncomfortable to be so bloated all the time. And then also very mucousy stools.
Do these symptoms, vary from male to female?
So females are actually twice more likely to experience IBS than males. And as blessed as us females are, during our menstrual cycles, we you can experience it significantly worse. Yeah, the symptoms.
I want to get in more about the food and also treatment options available, but this is the conversation we're having today. It is IBS Awareness Month. Dr. Clara's not going anywhere, but if you do have any questions or maybe just want to weigh in on the conversation, Expresso Morning Show on S3, we'd love to hear from you. It's my feel-good breakfast show. It is your feel-good Good Breakfast Show, and we are continuing our health discussion with regards to irritable bowel syndrome. It is an intestinal disorder causing pain in the stomach as well as wind, diarrhea and constipation. Now, the cause of IBS isn't really well known, and management of the condition needs to be a long-term strategy. Registered dietitian Clara McLennan has joined us this morning to share her extensive knowledge on this topic. And we were speaking about it because people always want to know that quick fix. They want to know, okay, I got IBS, how do I fix it? But how do we diagnose that you actually have IBS and not just a funny tummy?
Yeah, so the first thing that I would recommend is not to do a self-diagnosis on Dr. Google, as a lot of us do. So I would recommend to first go see your GP, or better to go to a specialist, a gastroenterologist. That's always the best line to make an appointment, even if you have to wait a couple of weeks. At this appointment, the specialist will probably ask you a whole bunch of medical history questions, and this will include things like what symptoms are you experiencing, how long have they been around, when do they happen, what are your feelings about it, etc. Then they would also do a clinical examination, which can include a whole bunch of tests. From there, the specialist will then decide, okay, do they feel that any more investigations or exams need to be performed. And now this is one of the major things with IBS as well, is there is no diagnostic tool or test to diagnose IBS.
Okay, got it.
So what they do, it's actually a diagnosis by exclusion. So what that means is they run a whole bunch of different types of tests, and if you test negative for all of those, then they will diagnose you as having IBS. So those tests, and they can be quite extensive, is sending a scope, so like a little video camera, either up your rectum to see what's happening in your colon, or down your throat to see what's happening in your esophagus or your stomach, to see if there's any issues with the lining of it, any sores that could be causing any of the symptoms that you're experiencing. Also X-rays or CT scans, again, to have some imaging of your abdominal area or pelvic area. They will also test you for intolerances, specifically your lactose intolerance. This is the sugar that's found in dairy. And a lot of people that do have IBS actually are lactose intolerant. Other tests can include a breath test. This is, you literally just blow into a machine and they test the amount of bacteria, so bad bacteria. There could be an overgrowth in your gut, as well as a stool sample. Again, looking if there's any bacteria, parasites, or bile that can be causing the symptoms.
Interesting. Now, would you say that some people are more susceptible to this disorder than others?
Well, as I mentioned, women are unfortunately twice more likely to get IBS than their male counterparts. But look, all of us can be susceptible to IBS, and it does also play a huge role in your lifestyle factors and how you manage your lifestyle. That being, if you have a lot of stress, especially emotional stress, can be a contributor to it. As mentioned, if you had an intense or severe GI tract infection with all that bacteria, overgrowth, or abnormality thereof, so those can all contribute to it, yeah.
We touched on it briefly, and we speak about, the quality of life the person would have if they were suffering with IBS. Let's speak about, long-term, how this will affect you in the long run.
Yeah, so I think, for patients that have got IBS, it's like a double-edged sword, that they get so anxious and so stressed about their symptoms. So imagine you're sitting at a dinner table and all of a sudden you get this major abdominal pain, or you're like, oh my gosh, I have to run to the loo, or you're out for dinner with friends. That causes stress and anxiety because nobody wants to deal with that. Nobody wants to manage that. But then IBS is also caused from stress and anxiety. So the quality of life of these patients, trying to find a solution for it is really the right answer.
And we're going to be talking about that because certain foods can flare up IBS, and we're going to touch about that, and as well as treatment options available in the next segment. Again, if you do want to weigh in, we'd love to hear from you. Expresso Morning Show on S3.
It's my feel-good breakfast show.
Everybody. Now, if you don't know, April is Irritable Bowel Syndrome Awareness Month, so there's no better time for us to center our health topic around IBS. We have spent the morning with a registered dietitian, Clara, as she has shared knowledge around the condition with us. Clara, so good to have you with us. Let us talk food when it comes to, trying to get a grip on this. When it comes to our dietary needs, how should we be conscious with regards to this if you do have IBS?
So if you have been diagnosed with IBS, I really would recommend you to make an appointment with a registered dietitian, just because the journey that these patients go on is really a hard and long journey. It's not just a quick fix like taking a Panado for a headache. It really is a lifestyle change, and it's important to note here, specifically with IBS patients, is that they're all different. So what works for you would not at all work for me, not necessarily. So patients that do have IBS, a couple of just recommendations is to increase their fiber intake. So this is with whole foods, whole fruits, vegetables, nuts, seeds, legumes. The second is to increase your clean, fresh water intake. This can range between 1.5 to 2.5 liters, depending on the individual, how active they are. Thirdly, if you are lactose intolerant, as I mentioned, a lot of IBS patients are lactose intolerant, to eliminate anything that has got lactose in it, and this is mainly your dairy products. But what's important here is that these patients are still getting your calcium, because calcium is found predominantly in our dairy products. And so to give recommendations such as eating lots of broccoli, spinach, or just simply taking a supplement. And then the biggest thing with IBS patients is that they get put on a low FODMAPs diet. So FODMAPs is an acronym, and it's very technical and very scientific, but it stands for fermented oligosaccharides, disaccharides, monosaccharides, and polyols.
How you got that, girl? Firstly, woo, you got
So
it.
these are a bunch of carbohydrates that are maybe not as easily digested but by that person that has got IBS. So this is where the really tricky part comes in, is that, let's say I had IBS. I could maybe tolerate a fermentable, but I will not tolerate a disaccharide. So all of these things are like your garlics, your onions, they're all in different categories. Your fruits, your sweeteners, your lentils, your beans, and there is a long list of foods that you should not be eating. But what I always say to my patients on a FODMAPs diet, the list of foods that you can eat is so much longer. So it's a long, very intimate journey that a patient goes on with a dietitian to try and identify which one of these FODMAPs should you be excluding from your diet, which ones can you include, and then here's also another catch, what can you tolerate of that inclusion food. So, for example, you might be able to tolerate garlic, but only a teaspoon of garlic in a meal. If you have just a teaspoon and a bit of garlic in your meal, you can have a symptom, yeah.
Wow, so it's not one size fits all, but what type of lifestyle changes should they overall be making with this? Because I mean, you should obviously be cutting out processed food, alcohol, sugary drinks, all of those things as well.
Look, again, as a dietitian, we always want to treat our patients as individuals. So it really, really depends who that person is, what their lifestyle looks like, what they do from day to day. But yes, mainly to exclude anything that's processed, your gaseous food, so that would be like your broccolis or your garlics, your chickpeas, some fruits, and also some of your sweeteners, alcohols, teas, and caffeine is also a very big one that we tell patients to completely avoid if they have IBS.
Okay, treatment and cure. Is there a treatment plan? Is there a cure plan? Because like we said, it is a lifestyle change. It's not going to happen overnight. So that's definitely steps to making sure that it is treatable and or manageable. But is there any cure for IBS?
So other treatment modalities could be exercise. So the World Health Organization recommends 150 minutes of moderate exercise a week. So moderate exercise is not just taking a nice stroll down the promenade in Sea Point.
Which is cute.
You actually need to sweat a little bit. Your cheeks need to be flushed. Meditation has also been recommended, so having a mindfulness practice. And what this does is it just allows a person to connect to their internal environment and decreases anxiety and stress. And then also some probiotics or a fiber supplement.
And I want to mention probiotics because that's actually how I got into my journey. You know, I used to cut out everything, white rice, bread, pasta, thinking that I, was triggered by IBS. But when I kind of just listened to my body, understood what was going on in my gut, and a probiotic actually helped me with this. So how beneficial is taking a probiotic?
Again, it's individualized, and as I said, we need to treat patients on an individualized basis. But probiotics You want to make your gut microbiome as strong as possible. So inside of our guts, we have bacteria. We've got bad bacteria, and we also have good bacteria. And we want to keep the balance and the equilibrium between those. So taking a probiotic is important. I must say it depends what probiotic. So yes, and that's, again, depends on the individual, depends what their needs are. You get different strains of probiotics, which are important for different things. So please don't, if you do have symptoms and you do have IBS, just going to your local pharmacy and picking the most expensive one in the rack, I wouldn't recommend that.
Definitely not.
See a specialist, and then they can recommend to you what types of probiotics you need for yours.
Works for you. We have some comments and questions that came through on our social media. We have this one from Tremaine January saying, my daughter has been suffering since she was a teen, hospital in and out, had to miss a lot of school due to pain. She's 23 now and doing much better, still struggling with some dietary issues. Any suggestions?
Yeah, so what I actually wanted to mention is IBS does arise between from the end of teen years to about 40. So that's like really the age group that we see it. What I would recommend is that that girl or that lady come and make an appointment at a dietitian, wherever in her area is, and she can work closely with her dietitian so that the dietitian could perhaps recommend her to go on the FODMAPs diet to really identify what foods she should be excluding, what she can include, and not just be fearful of all types of foods that gets put on her plate to think, oh my gosh, if I eat this piece of onion, I'm going to have diarrhea for the next 2 days, and my stomach cramps are going to be so severe I can't move out of bed. Because that's not the way to live your life.
Well, it is IBS Awareness Month. Clara, so good to be able to connect with you. Thank you for all your wisdom and knowledge on this. Again, if you have any questions, reach out to Clara. We are going to put her details up on the screen right now. We'd love to hear from you.